Remember, we've got lots of myths to bust. By sequential monitoring of horses using the Ridden Horse Pain Ethogram, we can facilitate the early identification of a potential problem and get it investigated and hopefully successfully treated earlier on. We need to educate riders and trainers that a horse's performance can potentially be improved if underlying pain is removed. We need to educate riders and trainers that there are associations between competition performances and Ridden Horse Pain Ethogram scores, as I'm going to demonstrate to you. So, if the Ridden Horse Pain Ethogram score is 8 or more, it is highly likely to reflect the presence of musculoskeletal pain. And this should stimulate a comprehensive assessment of the horse, the rider, and the tack to determine the presence or absence of lameness, thoracolumbo-sacral region pain, lumbosacroiliac joint region pain, cervical pain, saddle fit, and the rider's weight distribution. So in conclusion, a Ridden Horse Pain Ethogram score of 8 or more is likely to reflect the presence of musculoskeletal pain, although some lame horses score less than 8. The improvement in Ridden Horse Pain Ethogram scores after diagnostic anaesthesia provides strong evidence of a causal relationship between pain and behaviour. Even if a horse appears non-lame in hand, it may be lame when ridden, and this may be manifest by its behaviour. It's an indicator that something is not right. So problems which have been labelled as training-related, rider-related or behavioural, such as resistances, spookiness and tension, tail swishing, head tilts, or that is just how the horse has always gone, are usually pain-induced. The behaviours which are demonstrated do not reflect the source of pain. Each horse reacts as an individual and they have variable pain thresholds. And this is going to be influenced somewhat by the type, intensity and variety of work that the horse performs. It's also going to be reflected by the horse's inherent athletic ability and its tolerance and willingness to cooperate or comply with the rider's cues, despite the presence of discomfort. There are other factors to consider which may reflect musculoskeletal pain, but which were not included in the Ridden Horse Pain Ethogram. And these include repetitive grinding of the teeth or chomping on the bit, the horse yanking down with the head and neck, pulling the rider out of the saddle, sweating disproportionately to the horse's fitness, work intensity and environmental conditions, as we see on the right, abnormal respiratory noises, a delayed recovery of the resting respiratory rate and pattern relative to the fitness, work intensity and environmental conditions, and excessive blinking. These behaviours were documented before and after diagnostic anaesthesia in the recent publication by Dyson and Pollard, and they did reduce in frequency after abolition of underlying pain. So we do believe that these are related to stress and discomfort. I believe that we have a moral responsibility to educate ourselves, that is the veterinary profession, riders, trainers and other paraprofessionals about the value of the Ridden Horse Pain Ethogram.